Dear student, in this video, I will discuss two explain why questions. One is why high protein diet increases both glomerular filtration rate and renal blood flow, and the second is why high protein diet increases the ability of the kidneys to concentrate the urine. So the cause is the same. A person is eating or taking high protein diet. Now its effect on GFR or glomerular filtration rate and the renal blood flow that we want to know, and its effect on the concentrating ability of the kidney that we also want to know. So the answer of the first question, why the high protein diet intake will increase the GFR and the renal blood flow, is that with a chronic high protein diet such as one that contains large amounts of meat, it will increase the GFR and renal blood flow due to partly the growth of the kidneys. As the kidney is functioning high, so as a result of that, the growth of the kidney will occur and that will increase the GFR and the renal blood flow. However, GFR and renal blood flow increase 20 to 30% within 1 to 2 hours after a person eats a high protein meal. That indicates that at the resting state, when all the glomeruli are not functioning, but when more workload is applied to it, so it will function much higher. So this is also applicable if high glucose diet is also given to a person, then the renal blood flow and the GFR will be increased. So increased performance of the kidney is the main reason why there will be increased GFR and the renal blood flow. The second question, why high protein diet increases the ability of the kidneys to concentrate the urine. So if a person is taking high protein diet, then the concentrating ability of urine will be more. Urine will be more concentrated in that person. That we want to know what is the explanation. The first interesting point is that high protein diet, it makes more urea, and this in turn makes the urine concentrated. The urea content of tubular fluid, it depends mainly on the urea filtered in the glomerular filtering membrane, which depends on the protein content of the diet. So if the diet is having more protein, that means more urea production. That urea is responsible for the changing the concentrating ability of the kidney. How it is doing that, so that we will see later. So here we can see that from the protein we know that there will be generation of amino acid, ammonia will be produced, this toxic ammonia will be neutralized in the liver. As a result of that, there will be formation of urea, that urea will be excreted. So more protein means more urea. Here we also can see that if the nitrogen intake it is increased, that is the protein intake is more, so urea production is also increased in a linear fashion. Okay, so more protein diet means blood urea nitrogen concentration will be more. Now how urea is making the urine more concentrated, that we want to know. So for this we have to follow the movement of urea through the renal tubules. So in the renal tubule, some quantity of urea is reabsorbed in the proximal convoluted tubule. However, except in the inner medullary portion of the collecting duct, the rest of the tubular epithelium, the whole tubular epithelium, it is relatively impermeable to urea. So only very few amount is reabsorbed at the proximal convoluted tubule. The almost all part of this renal tubule, except the medullary collecting duct portion, the renal tubule is relatively impermeable to urea. And you will see that some amount of urea is also secreted at the descending loop of the Henle, descending limb of the loop of the Henle. Okay, so the urea concentration, therefore we can say that the urea concentration is gradually increasing. Okay, it is secreted here, it is not reabsorbed. So by the time the tubular fluid, it reaches the medullary part of the collecting duct, its urea concentration is very high. So in the inner medulla, so by virtue of concentration gradient, urea moves from the tubular fluid into the interstitium passively. So when the urea is removed from the tubular fluid into the interstitium, so along with it, water also moves out of the tubular lumen. Okay. So urea is coming out passively, along with it, water is also coming out. So the urine inside the tubule, it will become more concentrated. Okay. Now what will happen to the urea that is released in this interstitium? If it is released, this release is on and on, then the medullary concentration gradient, it will change. Okay, so urea is very important for generating the osmotic gradient in the medullary pyramid. Okay, so the water and the urea that enters into the interstitium, it will be taken up by the vasa recta, and consequently osmolar dilution of the interstitium, it will be prevented. Okay, now this movement of urea at this portion, it will be facilitated by some urea transporters that we want to highlight. But the crux of this point is, if the person is taking high protein diet, the production of more urea, that urea, it is almost impermeable to the tubule and when it will reach the inner portion of the medullary portion of the collecting duct, so its concentration will become very high. So it will be passively, it will come out into the interstitium. Along with it, water will come out. So within the tubule, the urine will become concentrated. So now we want to highlight few points about the urea transporter. The movement of urea in the collecting duct of kidney, it is facilitated by urea transporter A1. So that is UTA1. There are two types of urea transporters that help urea transport by facilitated diffusion. One is this UTA, another is the UTB. UTA is found in the kidney and UTB will be found in red blood cells. In kidney, this UTA, it also has four subtypes, UTA1 to UTA4. A1 to A4. Now this UTA1, it is influenced by the ADH. Therefore, ADH facilitates urea reabsorption in the kidney. We know that antidiuretic hormone, what is the function of this antidiuretic hormone? So we know that it will prevent the diuresis. It will help in the reabsorption of water. Okay. So when this water reabsorption, it is facilitated by ADH, and this ADH will influence this UTA1 receptor that will also help the transport of urea and water in the medullary collecting duct, and they will come into the interstitium, and this will also help to build up the hyperosmolarity of the interstitium. So this is about the urea transporter. So the main point is, when high protein diet is there, that means more production of urea. This urea will come out of the medullary collecting duct, and along with it, the water will come out, and this will cause increased concentration of the urine. And this movement of urea is facilitated by UTA1 receptor at this medullary collecting duct, and this UTA1 is also influenced by antidiuretic hormone, which actually helps in the reabsorption of water as well, and this also helps in the building up of hyperosmolarity of the interstitium. Some clinical aspect of this UTA1 receptor. So if there is sepsis, nephrotic syndrome, then chloroquine drug, hepatorenal syndrome, so there will be reduction of this UTA1 receptor. Okay, and in case of calcineurin inhibition, there will be increased phosphorylation of UTA1. So when there is reduction of abundance of UTA1, this may lead to uremia. or renal failure features. Okay, bladder cancer can reduce the functioning of UTB abundance, and that also can uh, cause the dysfunction of the urea metabolism. So we came to know that high protein diet, it has the influence on the GFR and renal blood flow. The reason is different why it is increasing the GFR and renal blood flow, and this high protein diet also has influence on the concentrating ability of the kidney. It will increase the urinary concentration. That the explanation of it is also different. It is mediated by urea. So the reference is Gannon's Textbook of Physiology, 26th edition, page number 676. Thank you.